Hey, Dr. Karp here, and welcome to my channel, the channel where my goal is for you to become your own authority in health. And today we are going to be discussing the problem with supplements, ? Is it a problem or isn't it a problem? By the end of this lecture, you are going to understand that the people who are looking at this issue are looking at it through two different lenses, the lens of public health and the lens of personalized medicine. You'll understand why they think it's bad, mainly because they are looking at it mainly from this public health perspective. You'll also have a little analogy to sort of put everything in context, and you'll also have a whole bunch of examples that will allow you to see why looking at it through the lens of personalized medicine will allow you to understand why and how supplements can be amazing, but you have to be smart about it. And you'll understand why looking at it again through this lens is going to be so important so that you can, again, make decisions for yourself and for your family. So let's cut right to the chase. 2 weeks ago, my friend Jay sent me this article over at Medium, medium.com. And the title of this is the title of my lecture, The Problem with Supplements. But I put a question mark on there. Of course, this is really looking at things from a public health perspective. And when you look at it from that perspective, you can make a very strong case against supplements. And we're going to go through this article in the mind map. And if you haven't seen a mind map before, well, this is what it looks like. And it's a way of putting things in context in a graphical way, because once you sort of can see things in their context, when you can look at things from two different sides and look at things through two different lenses and see it visually, then it helps you to remember it and to understand it better. So let's jump right into the most important part of this issue, which is this issue of public health versus personalized medicine. And I'm just going to minimize these things here just so well, I'm not able to do that, so we'll keep that up there for now. But let's talk about public health perspective. Many in academia look at everything through this screen or lens of public health. And there are pros and there are cons. The pros are, of course, that really, quite frankly, these are well-meaning professionals looking to make a huge impact on public health, and they do. These public health recommendations do make a difference in the health of the population. Like the food pyramid impacts, sometimes that could be a negative. That's why I put it also in the cons. But the point is that these widespread studies that look at 20,000 people or sometimes several thousand people that haven't been qualified for necessarily, it's just sort of broad sweep of the population. They're looking for shifts that they can then make into public health recommendations. The cons for this are that the public health, they're often unable to see that the examples which I'm going to show you are significant. They often underestimate the individual variability of the population. They sort of, I don't want to make it sound negative that they see people as numbers and data, but that's how it really is. They're often focused on hardcore mortality data, like this X. If you give people X, then the death rate is Y, and therefore we need to make a Z recommendation. They have little concern for quality of life, in the sense that they're not looking at things for subjective outcomes like energy level or human optimization or sleep values or such. Those things can be studied, but those types of outcomes, which again can be studied, are not necessarily of interest to them. They're looking at what they consider to be more black and white, life and death, disease rate, etc. types of things. And when you're looking at things from that, then you really have a little bit of a different view of health in general. And now it doesn't mean that these people are evil or anything of the sort. These are, as I said, well-meaning professionals looking to make a huge impact on public health. And as I said, they often do, and they often make good ones. But when we look at it from the personalized medicine perspective, then we are able to make different decisions that are just as valid as these. In fact, they're often more valid because we're dealing with individual variability, that everyone is different in so many different ways. And now we have things like nutrigenomics and advanced labs that can show all kinds of different things that weren't available before. But Sir William Osler, who was a Canadian physician, who really was the founder, essentially, of modern medicine in the United States at Johns Hopkins. He, as I said, he was Canadian, but he was brought to Johns Hopkins in Baltimore by Johns Hopkins, and really was just this remarkable, forward-thinking guy back then. Really just an absolute genius. Some of his quotes are incredible. This one, the good physician treats the disease, the great physician treats the patient who has the disease. But my favorite of all time is, it is more important to know what sort of person has a disease than to know what sort of a disease a person has. All too often, medical doctors like myself have lost this. They see a patient, he's immediately characterized or categorized as having a disease. They use a few different variables to decide which medication to give, and then they go see the next patient. Sir William Osler is cautioning us to know what sort of person we are dealing with and not to characterize or categorize them immediately. So personalized medicine, patient-centered medicine, this has been around for a lot longer, and I believe if Sir William Osler was around today, he would really be excited with all the new lab tests and genetics that we have at our disposal. The pros are that individual treatment can be tailored to the specific person. There are cons that are brought up by people. For example, there are much smaller studies that are used for making recommendations in terms of hardcore number data, evidence-based medicine. There's evolving science in some cases when it comes to new lab tests that are developed, proper recommendations for genetic polymorphisms, markers that you have in your genes that could predispose you to, say, vitamin D or vitamin C deficiencies. All of these things are evolving, but they're evolving very, very quickly, and already we can use some of this data to make specific recommendations, especially when it comes to supplements. So let's close these and come on down to the first opinion, which is, oh, they are bad. And we're going to go through basically some of the comments that were in the article. Now, the FDA writes, the growth in the number of adulterated and misbranded products, including those spiked with drug ingredients not declared on their labels, misleading claims, and other risks creates new potential dangers, says U.S. Food and Drug Administration Commissioner Dr. Scott Gottlieb in a February press release. The FDA, I don't want this to turn into an anti-FDA video, but so I'm just going to say that obviously that it's true that there needs to be accountability in supplement manufacturing. I'm not sure that the FDA is necessarily the right agency to be doing that, but I'm going to leave that there. Joanna Sachs, professor of law at California Western Law School, says there are really no laws that make supplement companies go through the FDA in the first place. And I would say, what maybe again, for us to rely on the FDA, who has an incredibly poor record when it comes to so many different things, which I don't want to this video to degenerate into, but nonetheless, obviously it's true. We want to make sure that things are safe, but we don't want to do it at the risk of having the FDA control the supplement manufacturers, because what's going to happen if that is the case is you're going to have people with a public health lens not having the data that they think is good enough and saying, well, it doesn't do anything, so therefore, because of the risk of misbranded and spiked products, we're going to make it illegal. And that's something that we don't want. That would be a severe diminishment in health freedom and something that we should be careful of. So when you have people, or you hear people say the FDA needs to step in, be very, very wary, because your health freedom is at risk if that's the case. Chandin Sen, Vice President of Research at the Indiana University School of Medicine, says when you talk about fish oil and omega-3, it's very difficult and expensive to preserve the goodness of the fatty acids and to put it in capsules. That's true. So what's the answer? The answer is, again, my goal here is for you to become your own authority in health. And the fact is that you need to pick high quality fish oil if that's something that is indicated for you. You can find high quality omega-3 fatty acids. So the point is that the educated consumer has nothing to fear. There are enough ways of determining the quality and the non-oxidation of fish oil that if you're smart, that's not an issue. Sen says he's interacted with many supplement companies, and his experience by and large has been that most of them spend far, far more of their budget on product marketing than on proper research and development. This is clearly not in the best interest of consumers. Well, I would say to this that he's not really he doesn't really understand how business works. You do need to most of the time. First of all, I've interacted with many supplement manufacturers at trade shows and in other settings because I'm a health entrepreneur, food entrepreneur myself, and I can tell you that they're not doing the research. The research is being done at the university level and is being done by researchers who are interested in nutrients and nutraceuticals and supplements, and then usually the manufacturer sees these studies and then they make the supplements. So obviously there are supplement manufacturers that do some studies, but you don't necessarily want them necessarily to be designing those studies. You want the studies to be done by well-meaning people who are interested in the research. And so this comment, well, I think I just explained what my comments are about that. Dr. Leese, professor of medicine and director of clinical nutrition at UCLA Medical Center, says, I see patients who come in with a whole bag of supplements they're taking, an immune booster, something for the hair, something for vision, something for skin, but if you look at the ingredients, you see they're all the same. Someone is taking 3 or 4 things with vitamin A and also a multivitamin with vitamin A, and all these can add up. That's true. Keep in mind that there are very few side effects to supplements reported in the United States. And again, we're not talking. Obviously, this is a concern. I would hope that nobody here who is listening to this just sees an advertisement for something for their hair or an immune booster and they just buy it and take it. That's not what we're looking for here. So we're looking for, or my channel is focused on giving you the education so you can become your own authority. And I would hope that you wouldn't be swayed by marketers to be taking supplements. Dr. Mark Moyad, Jenkins Palm Kempner Director of Preventive and Alternative Medicine at the University of Michigan, says the idea that you can take 10 pills a day and fix everything or live forever is faulty. There's a huge disconnect between people's perception of supplements and the reality, and that reality can be really destructive. Well, I agree, again, that 10 pills a day, this idea that pills fix everything, I'm not sure how accurate that is, even amongst people who are taking 10 pills a day to fix everything. But the fact that it's really destructive is not true. Nonetheless, I wouldn't recommend that people do that. I understand and respect the power of pills, he says. Like prescription drugs, supplements can help people with a diagnosed medical condition or deficiency. And like pharmaceuticals, supplements come with risks and side effects, but they pale in comparison, in general, to pharmaceuticals. I've yet to come across any product that someone could sell me that was the secret to health or longevity, but all the boring healthy diet, good night's sleep, exercise, the evidence for that has only become stronger. Right. Again, there's not going to be any product that comes across and is going to be a pill necessarily that's going to increase health or longevity necessarily. although they are doing a study right now on metformin, which is a diabetic medicine that potentially could actually increase longevity. Dr. Moayed further says, there's a desire to go from point A to point B as quickly and easily as possible, and taking pills to do that is very chic right now. I think we'll get to a place where some supplements could have incredible value in disease treatment, but people need to wake up to the fact that if they're experimenting on themselves with these products today, they could wake up in a few years and have done real harm. Okay, so yeah, I don't necessarily have anything to say about that. I think Dr. Moayed may be thinking that people, and he rightly is probably seeing patients, as I do, that come in with a bag of all kinds of stuff, and no one is recommending that. But to use that as an excuse to therefore degrade or diminish or downplay the fact that supplements can be used in a smart fashion is really not correct, in my opinion. So always they use the beta carotene study to say, well, let's go through it and then you'll see. Basically, this alpha tocopherol beta carotene cancer prevention trial, the risk of lung cancer in the groups taking beta carotene supplement was increased by 16% after 6 years in the participants. Then there was the CARROT trial, and that, of course, was pun intended, where the risk of lung cancer was 16% after 6 years and 28% after 4 years in the CARROT participants. And what Dr. Gil Omen, who was involved, said, what we observed was maybe the most potent carcinogenic effect ever discovered. It was truly shocking. I think that seems to be a little bit over the top, but nonetheless, obviously this is serious, absolutely serious. Of course, there's the Physicians Health study that showed that beta-carotene supplementation. So the Physicians Health study examined the effect of beta-carotene supplementation on cancer risk in 22,000 physicians, of whom only 11% were current smokers. In that lower risk population, beta-carotene supplementation for more than 12 years was not associated with an increased risk. And this was conducted in China, 29,000 participants, and they were randomized to beta-carotene, 30 milligrams, and 15 milligrams of selenium was not found to be associated with lung cancer mortality 10 years after the intervention ended. This is not to say that anyone should be taking beta-carotene by themselves. Our knowledge has progressed so much since then that no one would suggest taking beta-carotene. This is usually used by people who are against supplements to say, see, if this happened, then it's likely something else down the road may happen. And the answer is that potentially there could be an issue with a single nutrient. Of course, now we know that our science has progressed significantly. Again, that doesn't mean that we might find another supplement that potentially could be dangerous. That's why you really have to look at the studies yourself and become a smart consumer. Become your own authority. Dr. Joanne Manson, chief of the Division of Preventive Medicine at Brigham and Women's Hospital in Boston, certainly an amazing place. If you're taking a handful of supplements without doctor's oversight, she says, there's the potential for almost anything to happen. But the point is that hardly anything ever does happen when people do that. Nonetheless, I'm not suggesting anyone, if you don't have a good reason for taking a supplement, you shouldn't be taking it. Whether you need a doctor's oversight, I would seriously question that, because I believe, again, that all of you are able to find the right experts and guidance to be able to help you make those decisions for yourself. So that's the opinion that they are bad. And what's the opinion that they're amazing? Well, Dr. Mark Hyman, Director of Functional Medicine at the Cleveland Clinic, says even with a perfect diet, the combination of many things, including our depleted soils, the storage and transportation of our food, genetic alterations of traditional heirloom species, and the increased stress and nutritional demands resulting from a toxic environment, make it impossible for us to get the vitamins and minerals we need solely from the foods we eat. So, do you know why you're taking those supplements? If you can't give a reason for each supplement that you're taking, then I would stop and learn. Become your own authority. Now let's go into some examples of why vitamins, if you do know, why potentially they could be helpful. Here are some main reasons why supplements would be very valuable for you. Let's say you're on a medication. If you're on a statin, you should be taking CoQ10 because statins decrease the levels of CoQ10. If you're on a proton pump inhibitor for your stomach acid, that can diminish your B12. So you should be checking your B12 level, and if it's low, you should be supplementing. What about if you have a genetic susceptibility to something? A lot of people have this MTHFR SNP, single nucleotide polymorphism, and sometimes that requires methylfolate supplementation. This is a large percentage of the population, and while not everyone is being tested for this yet, but eventually, as this becomes more well known and genetics becomes more well known, and could be 10 years from now, this will be standard, and everyone will know this. Say you have a CYP2R1 or a GSTT11. This predisposes you to low vitamin D and vitamin C respectively. So this would be a situation where you may need more vitamin D than someone who doesn't have that SNP. Or if you have an F5 gene, these risk variants benefit from vitamin D supplementation. So all of these things in the NOS3 gene, these risk variants benefit from higher intake of omega-3 oils. So once you know that you have these genes, and if anyone is interested, by the way, in testing these types of things, I do that. The link below I can get those labs for you wherever you are, and we would then have an hour on the phone, and I would go through each one of these things to help guide you in either diet changes or supplementation changes based on these results. The link is below if you want to enroll or become my online patient. Let's go to if you have lab tests to confirm that you are low in a nutrient. Well, vitamin D and RBC magnesium. A lot of people are low in magnesium, but if you just check magnesium in the blood, that's not accurate. The omega index to see what your level of omega-3 to 6, the ratio is. And then Genova, which is a lab which is coming out with amazing lab tests, has a NutriVal that really analyzes all sorts of things. And as I mentioned in the cons of supplementation, of personalized medicine, there is growing information, growing labs, in other words, new labs all the time that are being perfected and such. And so we're still early in those things, but some of these are incredibly valuable. Well, what if you are pregnant? Well, most people recommend folic acid, but folate is usually a lot safer. Folate would be a supplement that you would take, or if you're an athlete, maybe creatine or protein supplementation. Or what if you have a disease, maybe an autoimmune disease? A lot of them, like rheumatoid arthritis, respond to fish oil. Of course, once you realize that you need omega-3 oils, let's say, then you have to find a high-quality omega-3 oil, and there are resources for that. So this is the situation, and this is just a brief snapshot of what you have here. I could list dozens of diseases where there are studies to show. I have all kinds of books, peer-reviewed books. Specifically, I'm just looking at my wall of books as we speak, but there's one Dr. Ingrid Kolstad, who has put together amazing resources for this, and also from Oregon Health Science Institute also has remarkable information that, and I put that in the, let me close some of these. I put that in the references here. Oregon State, really remarkable resources for you when it comes to vitamins and minerals and such. So as you can see, when we looked at all of the different uses, again, that was just a very brief snapshot. See, when you look at it from this personalized perspective, when you're looking at each person as an individual, not as a number, and again, I'm not degrading or diminishing the studies that are done on public health, overall public health, but when I am sitting with someone, we can start with those public health. We can start at 30,000 feet, but eventually I need to be in the same room and look at the patient and understand the patient and use labs and understand what's going on with the patient to be able to make the right recommendations, whether that's genetics, whether they have a disease or predisposition, or there are problems with food access or food allergies, all kinds of different things that are so numerous that it would be, I would have to do hours and hours and hours just devoted to each issue. It's very, very, there's a lot of information. It's basically what I'm trying to say. So what's the analogy? Well, this is sort of a funny, simple analogy, but it's like a man, right, that needs to go on a very long trip to get home. Years ago, he would have the hotel wake him up, then he would use a map to get to the airport, then rely on signs at the airport to get his connections, and have his wife pick him up at the airport. Now, his smartphone would wake him up, he would use his GPS to find the airport, use an app for finding his connections, and take an Uber on the way home. So we are updating things for ourselves. And this analogy can be taken a little bit further to say that the public health people would say, well, let's design a notification system that would work for everyone. And let's design a transportation system to take him home that would work for everybody. And everyone is unique and different. And everyone has their own idiosyncrasies, not just preference-wise, but when it comes to their biology. So that is the problem with supplements. I hope that understanding this from a little bit of a different perspective really will give you a lot of motivation to be able to have the confidence to make the decisions that you require. If you're interested in talking to me, definitely let me know by becoming my patient below at the link. And you can set up a free consultation with me if you're interested in talking. That's available now. I'm not sure how long that will be available. Depends on the amount of people who are interested. And I hope that we really achieve the goals that we set out at the beginning of this lecture. One, to understand the lens between public health and personalized health and why it's important to really become your own authority, meaning to really focus in on personalized health, but learn as much as you can from the results of public health. And that most of the people who think that it's bad are really generalizing for the entire population, i.e. they're looking at it from that public health perspective. But it's amazing because we now know so much more and we're able to dial in and really recommend things specifically in a smart way that can improve so many things about your overall health. This is Dr. Karp. Thank you so much for watching. Please subscribe and hit that red bell. It really helps me when you do that so that you're notified for videos that are released on this channel. Thank you so much again for your attention. I love making these videos, and I certainly hope you enjoyed it.